Hi, and thank you for the chance to share with you a little bit our perspective as a trauma center on e-bike safety. I'm Dr. David Gibbs, and I'm the Division Chief of Pediatric Surgery and the Trauma Medical Director of the Pediatric Level 1 Trauma Center here at CHOC. First of all, e-bikes are actually a great invention and have a way of getting you out into somewhere and doing something that you might not otherwise do. So we think they're great with the appropriate safety precautions. Unfortunately, as a trauma center, we see the other side of e-bikes. The most common injuries that we see, as well as the ones that other emergency rooms see, are concussions, more serious injuries such as fractured skulls and significant brain injury, as well as facial injuries and broken bones. Parents and people who ride an e-bike don't need to be afraid of them, but they need to respect them and be aware that they're not like a regular bicycle. They're almost like a motorcycle that's just more silent. There's a few features that you absolutely have to keep in mind with an e-bike, beginning with before you get on the thing. First of all, always wear a helmet. The injuries that we do see are sometimes tragic and usually completely preventable. Secondly, make sure that the bike is appropriately sized and properly maintained, with the air pressure being correct and the e-bike being of the right size that you can get on and get off of easily. E-bikes can be heavy, and getting on them and off them is not like any other bicycle. Third, make sure that you're getting on it in a place where you have the chance to move around and practice maneuverability rather than mounting an e-bike for the first time in a potentially unsafe place. Double riding injuries, when they happen, can be serious and significant. These bikes are not intended and designed for double riders, and the rider in the back can fall off quickly and easily because they change the weight of the bike, which is already relatively top heavy, and furthermore, rapid acceleration and deceleration can result in them being thrown back. And some patients that come in with this aren't wearing a helmet, and because they're thrown backwards rather than sideways, are at even greater risk of serious, significant injury. Most e-bikes are actually well, thoughtfully, thoroughly, and safely designed. However, human ingenuity has ways of getting them into trouble, even when they shouldn't. But there are some features that are absolutely universal and should be included. A well-maintained bike in good working order with adequate tire pressure, but also a bike with an air horn to be used for autos only, not for pedestrians, and a bell which can be used for being around pedestrians are critical features. In addition, the rider, as mentioned before, needs to be wearing a helmet and ideally would be wearing bright or reflective clothing. Basically, the features to avoid are anything on the bicycle or on the rider that stream out and can get caught in the spokes. Additionally, a bike that's old, not well maintained, or with inadequate tire pressure. And then finally, a bike that does not have an air horn and a bell should be avoided. Thank you, and ride safe.